is Dr. Natalie Rout, who can help answer more of those questions on symptoms and self-isolation. Dr. Rout, thanks once again for joining us today. Let's just touch on the news that we heard just now, that the youngest person appears to have died after being testing positive for coronavirus, a 21-year-old from High Wycombe. This is a worrying development, isn't it?
Yes, it really is. And I can see how this news is going to really worry a lot of people, because where we've been saying that actually 80% of most people will have mild illnesses and aren't necessarily going to end up in hospital, this news does come as a shock to everyone. And I think it is very scary for medical professionals as well as the general public. But please try not to get too scared. What we do know from the statistics is that 80% of people will only get a mild illness. And so we just have to please stick to the advice to stay at home as much as possible. Wash your hands regularly, try and avoid making unnecessary trips, and just look out for those people around you that you know are vulnerable.
Of course, advice, stay at home, especially if you've got symptoms that think maybe COVID-19. Just talk us through once again those symptoms, which is really, really crucial for people to understand.
So the most common symptom is a dry, continuous cough. And then the other symptom is a fever. Now, a fever, if you have a thermometer at home, please do check your temperature. If you don't have one, please buy one. It will be really useful for people that you're speaking to over the phone, healthcare professionals, your GP, if you have access to a thermometer, to just test how high your temperature is. And we're specifically looking for temperatures over 37.8 degrees. So dry, continuous cough and a fever, those are indications that, please, you may well have coronavirus. So please self-isolate for 7 days and try and stay away from people if you can.
Dr. Rout, what do you hear about these reports of new symptoms, including loss of smell and taste? What do you know about this?
Absolutely. Well, the loss of smell has been in the media a lot recently. There have been several reported cases, specifically from ear, nose and throat specialists, that this is potentially a sign of coronavirus, because they've noticed with several patients that is one of the signs. But we don't have enough data yet to say that is definitely linked to it. What we do know is that a lot of people suffering with a normal common cold, any sort of upper respiratory virus, can also suffer with loss of smell. There are lots of other symptoms that have been spotted in some cases as well, like a sore throat, feeling very fatigued, feeling like your muscles are aching, having a headache. There are lots of those symptoms as well, but for now we don't have enough evidence to show that there is a definitive correlation between those and the virus. So please, we should all be staying at home as much as possible anyway. We should all be practicing social distancing. I'm certainly telling my patients that are calling up saying that they're feeling a little bit tired and unwell and a little bit of a sore throat, to err on the side of caution, even though officially Public Health England guidance is that if you have a cough or a fever, those are the two main symptoms that you should treat for self-isolating yourself. We should all be trying to practice social distancing. So if you have any of those other symptoms, loss of smell, sore throat, headache, tiredness, please stay at home.
And we know that you've been at your surgery all day today, presumably seeing patients. What is the pressure like now on you and your colleagues? And have you got enough protective equipment that you need to keep you safe as well?
Well, actually, for a lot of GP practices, we've converted most of our consultations to telephone or video consulting, and we're trying to see only the people that really need to be seen. We are, of course, carrying on with things that are important, like child immunizations. We want to try and protect as many people as possible. But for those people that we think we can treat or advise over the phone or video, we are trying to do that. There is, of course, concern that there is a lot of pressure on hospitals and a lot of pressure on 111 services and the ambulance services. So there will be development of a lot of centres where we are seeing patients that we know have suspected COVID-19. And for those scenarios, we are concerned that we don't have enough PPE, enough personal protective equipment. There are limited stocks of face masks, aprons and gloves, and we certainly want to make sure we are protected and we're protecting the patients that we're seeing. So it was, we've heard from the government that they are going to send out more kits, but I know from speaking to my colleagues, from my own practice, from the things I'm hearing from my hospital colleagues as well, that right now there isn't enough protection in place for healthcare workers, and hopefully that's going to change very quickly. It certainly needs to.
Dr. Natalie, I'm so sorry to cut you off, but we are out of time. Thank you so much for speaking to us. I'm sure we'll speak to you again later in the week. Thank you.
Thank you.
For more